A basic ankle scan of the anterior ankle. So one big home base could be right over the just a transverse short axis view across the anterior part of the ankle. And right off the bat, we see a few different tendons, right? So right there in the middle of the screen, right there, we got anterior tibialis right there, a short axis view. Okay, we got your EHL right there. Okay, and what's cool about this, you can actually ask people to move their toe, and what I could do is I'm going to lift up your toe a little bit, so I have a little bit of offset there. You can actually move the toe, and you got your EHL there, and then over here you got your extension digitorum. Okay, and those are all short axis views. This off so you can relax a bit. Any of those tendons you can look in long axis as well. So anterior tibialis, you can follow a short axis line distally all the way down to where it inserts right there as it fades into the bone right there. Okay, and then also within any of these, I often recommend first finding them in short axis and then turning long axis to line up right on it. And you don't have cankles like a lot of my patients, so we got a little bit of kind of have the little crevices, and so if you run into a lot of trouble, you can put a big dollop of gel as a standoff. Right there, you can see her anterior tibialis in long axis right there, right across the top.
Talus navicular, medial cuneiform.
And then, yep, and then you got your joint right there. So as far as access for injecting for ankle joint, one of our favorite approaches actually is to kind of hover over the anterior tibialis, going long axis here, and there you can see the talar dome as well as the tibial plafond right there, and you got that fat pad deep to it. And so often you can guide a needle either out of plane this way or a short kind of combination of short and long axis, and put the needle down underneath that triangular fat pad. Everybody see that triangular fat pad there? And get into the joint and elevate that fat pad by injecting fluid there. So that is a quick demo of that, okay? Also, likewise, if you look into the anterior tarsal tunnel, any of these tendons, you can go long on it. Here's your EHL in long axis, okay? It says your digitorum as well. But you could also look at the deep peroneal nerve, as well as the anterior tibial artery, which is becoming the dorsalis pedis artery, right in the middle. Do you see underneath those muscles and tendons? There's a round anechoic structure that's an artery right in the kind of in the middle of the screen right there. And flanking it are going to be the deep peroneal nerve, and you can kind of see it right there. Yep, right there, yep. And so it's variable because it often crosses it. There it is crossing over the artery. See that? There it is. You guys see that? I'm kind of making it go over, back and forth, the artery right there. So you can actually find that nerve there. So you can see how what you're looking for is that kind of hyperechoic cluster.